Joined now by Chris Adkins from Kymanox, and we're again here in Philadelphia. And so just to warm things up, so Chris, why don't you give a quick background, but how did you get into life sciences?
Yeah, absolutely. So I'm a classically trained mechanical engineer, which is not normally the road that one takes to get into biotechnology as a background. I really stumbled into the industry coming out of undergrad. Believe it or not, I managed to go to school at NC State and come out into RTP and not even be aware that pharmaceuticals was all around me in my backyard. And then landed a job at Novartis working in drug substance technical development. Right, making phase 1, phase 2, actually worked on an RSV vaccine that was commercially approved by GSK now about 4 years ago. So I'm batting 1,000 on development projects. I don't work in development anymore because the odds aren't supposed to be quite that good. And then kind of went from there and worked through the industry on the supplier side of critical components, both in drug substance and drug product, and then landed here at Kymanox. But really the kind of commonality throughout that is having really a genuinely greater purpose to what you do in work than just showing up and turning pages and things like that.
Yeah, so
right?
a lot of folks I know in our industry, it's that it was something bigger than there's an end game. It's just like I'm pushing paper. I know, hey, if something I'm working on or I'm involved in gets to a patient, I could be part of that.
Yeah, exactly.
Where do you go to school, by the way?
NC State University in Raleigh.
Oh, you were there. Yeah, and that RTP is a hotbed, and it's a good mix. There's medical device as well as biopharma.
Correct.
In that market.
Correct. Right.
So
and even some small, some kind of prolific small molecule manufacturing and filling, right? Still in kind of the greater RTP area.
So it's pretty diverse then with the CDMOs too.
It is.
So if you had to go to campus and give advice to others like yourself who are looking at a career in the life sciences, what advice would you give them?
Yeah, absolutely. I think there are a tremendous number of folks who come out and really understand the science really, really well, but managing to mix that with the interpersonal communication, leadership skills, things like that. So spending time presenting and speaking in front of a room, right? Doing that on a regular basis. Most decent and above presenters are not born, they're made. Right? Every now and then someone has a particular gift for it, but even then practice really can encourage and can make them better. And so figuring that out as soon as you can, right, in your development, I think can have a really enormous long-term career ramifications, right? So that would be my kind of general advice to most folks who are already studying the science and already kind of considering this career pathway. And then the advice for someone like me would be, hey, you don't have to have it for your degree, but maybe take some organic chemistry and some other advanced chemistry classes. And stopping at Chem 2 is a bit of a limiting factor for me nowadays.
It's interesting you said, because many times people they think it's going to be just bench work.
Yeah.
But there's a whole nother flip side is on the business side. I think that's a good point of letting people know that there's other career paths.
Well, and whether you want to go into business, like myself, or even if you want to stay internal to your company, you have to be able to present your work. You have to be able to talk, confidently and competently, both to leadership that's in your direct technical vertical, but also folks who are parallel to you, right? So the formulation scientist has to be able to talk to the fill-finish operating team and be able to relate to each other and present why, no, I can't just get the viscosity below, 30 centipoi, so it's easier for you to fill. There's a little more to it than that, right?
So you came up from RTP. So why Philly and why now?
Yeah, absolutely. We've had a presence in Philadelphia for a number of years. We have an office, here local that's really focused around our, drug delivery considerations.
Physically, where's it at?
In King of Prussia.
Okay.
Yeah. So we're up here pretty frequently for that. But what really excites us, and it's a similar thing that excites us in RTP, in kind of the three major universities there, but we really see that the industry goes where the science is, right? So the excellent work here that's coming out of Penn, the things that has this really known as a hotbed in the advanced therapies world, right? Probably I think probably unquestionably the world expertise in cell therapy sits in Philadelphia as a whole. And so we're really excited about that. And in supporting and partnering for those products to go from just the academic bench to being successfully commercialized, where they can impact patients.
You talked about a lot of rapid changes happening right now. Is there anything you could recommend for either a podcast, a website, a networking event that you can go to keep current on some of the rapid changes in the
Yeah,
market?
no, that's a really good question. The first answer has got to be I'm a little biased. I host our Life Science Solutions podcast,
There you
so take a look on that wherever you listen to your podcast. Beyond that, I think it is really easy to underestimate all of the amazing work that's being done by some of the industry-leading, nonprofit groups, ISPE, PDA. We were at an ISPE event last night, and they talked about their recent publication in autologous and cell therapy development.
So it's a combination of listening and getting out there, because networking events post-COVID are some of the best places to have a conversation.
Absolutely,
right now.
right? And read some of these standards reports that the industry experts are putting out there, available for free, right?
So one last question. This weekend we have the Super Bowl.
Yeah, I've heard about that.
So what's your prediction for the Super Bowl?
Yeah, oh man. I don't even know that it's as much prediction, and I'm gonna hopefully be out of Philadelphia before this airs, because otherwise I'm probably gonna get
Stay away from the poll.
I'm gonna get destroyed. But personally, in sports, whenever I don't have a biased interest, and as far as I'm concerned, we don't have a professional football team in North Carolina. We essentially don't. We have a joke of one right now. So, but I do like to watch greatness, right? So I've really enjoyed watching LeBron James over his career in basketball, and then as we see what Steph Curry and some others have been able to accomplish. So I think it would be a treat to get to watch a three-peat, right? So that's my leaning. I think if you watch the Chiefs play this season, they have eked out so many one-score wins because of that kind of dynamic. We'll see. Maybe Saquon brings something that kind of changes the equation, but I'll follow the lead and take an off-the-wall prediction, and I'm going to say 45-21 Chiefs.
Interesting.
So
Well,
I do think it's going to be a shoot.
Well, be careful when you leave the room. This is Philadelphia, so you have to.
We're not going to tell anyone about that tonight, right? We can just keep that to us until this gets published.
This won't be published before this weekend. So
okay. All right.
Well, good,
The
Chris,
city is green. So
good, thanks for joining us. We appreciate it.
Yeah, absolutely.
Good.
Thanks.
Thank you. Thanks.